Hello, everyone. My name's Heidi Hubbard. I am a therapist with Marvel Wellness, and I am joined by Skyler Martin.
Hey there.
So today we are going to talk about men's mental health. So, um, men's mental health is often overlooked. I think that men maybe sometimes feel like they don't need additional help or resources outside of themselves. So today we're going to dig into what men's mental health can look like. Maybe. Why won't it? There we go. Do you want to take any lead, Skylar?
Well, yeah, one thing that I thought of instantly when you said sometimes men feel like they don't need anything outside of themselves. I think part of the struggle too with men's mental health is, and it's kind of obvious, but for a long time that's kind of been the way men are socialized is if you're going through something hard, just kind of get over it, keep going. Uh, if you're hurting, if you're upset, like just kind of lock that up tight, keep going. Like how you feel doesn't matter here. The outcome that you give us matters. The product you produce matters. The your ability to obey in a social setting matters. So I think it's a pretty big deal because even when we talk about men's mental health or like inviting men to come to therapy or doing things like that, we're kind of inviting them to do the opposite of what they've been trained socially to do for a long time. It's a pretty big deal.
Yeah, absolutely. So when talking about like the stigma of mental health, which is kind of what you were just talking about,
Mhm.
um, the cultural norms.
Mhm.
So, how that looks for men even talking about their feelings, how often are, even little boys told, like, stop crying, like,
Yeah.
man up, those kinds of things are instilled pretty young in our young kiddos about talking about feelings.
Absolutely. There's like an expectation, or there has been, at least for a long time, that men should be kind of stoic. And it's almost seen as like a virtue for men to just be kind of emotionless, purely rational. Um, and so it can make therapy feel very uncomfortable because, of course, the cliche therapy question is like, how do you feel? And
Uh-huh.
starting there so often, so it can feel like a man is coming into a very just a frontier that he doesn't know, an unknown space. And so in some ways, I mean, it makes perfect sense that men would feel worried about starting therapy or getting involved or anything like that. I think on another side of it, though, it's like we have a lot of work in the field of psychotherapy and just as a culture of just going like, oh, the way we envision masculinity and what it means to be a man isn't helping men get the help they need.
Yeah. Yeah, as you're kind of talking, the word that like kind of comes to my mind is like vulnerable. Like men coming to therapy and talking about their feelings is a really vulnerable place for them to be.
It really is. It's hard to talk about some of this without getting into a lot of the just like social history of it and stuff. But uh, for as much really good work has been done and as much good work feminism has done to treat inequality and make things much better for women, and it's still happening. It's weird how much that the old school version of like what it means to be a man and masculine kind of still stands. So things have changed a lot for women. There's a lot more freedom to join the workforce and have influence. But for whatever reason, men are still kind of treated like, well, you kind of just need to put your head down and get to work. And so I think that serves as another barrier to treatment.
Absolutely. How do you feel like you kind of approach men when they come in?
A big part of it for me, is therapy is often seen as a very like feminine space. It's seen as like well, this is a thing that women mostly do, and I'll go if my wife wants me to, or I'll go because my girlfriend said I have anger issues or whatever. and so for me, it's like therapy just has to feel like a normal conversation. It has to feel like there's not pressure to dive deep into the all your feelings right away. It just has to feel like this can be whatever you need it to be on the front end,
Yeah,
and not kind of requiring men to speak a language that they've been like punished for speaking most of their lives.
absolutely.
So I think that's a big part of it is when a man comes in, it's like we can just be, we don't have to, you know, get super vulnerable real quick. I think vulnerability is like anything else. It's like a muscle that you work and you get better at using and you get better at getting in touch with what's going on with yourself. So just starting small.
Yeah. Yeah. What is the kind of presenting concern,
Mm-hmm.
goals to kind of reach that, making it more concrete in nature as opposed to diving in and talking about all the feelings.
Absolutely.
Yeah. So kind of looking at common mental health issues. I mean, I feel like this could be true for men or women. But again, as we've been talking, like men are more apt to bury them, try to cope with them on their own, not sit around with buddies and chat about how they're feeling necessarily.
Yeah. Well, men are also more isolated from each other than ever before. Um, so I think there even though there's been a long standing like, men should put their head down, get to work, doesn't matter how you feel. There was kind of this thing built into society for a long time. Like you could go to a diner and look around and you would see a bunch of old guys drinking coffee and, complaining or talking about life or problem solving things together. And of course that's going to look a lot different than women sitting around and doing that, which is perfectly fine. But a lot of that's gone away. Like many of the men that I see experience a lot of isolation, a lot of loneliness, and there's probably all kinds of causes and reasons for that. But that's a huge aspect of the anxiety and depression and substance abuse piece is we're more isolated than ever. Most of the interactions that we do have are more superficial, on our phones. Um, there's not a lot of like sharing the load with other people. Whereas even though things were hard for men before, there was at least that aspect. I can kind of distribute my pressure and the pain of my life among people that care and can listen, and that's not as prevalent now, and so it makes anxiety, depression, obsessive compulsive disorders, I mean all kinds of things like go way up. We're very lonely.
Yeah. How do you feel like you address those in therapy with men?
Mm-hmm. Like the loneliness factor.
Yeah.
So I think it really is. It's like it's giving an invitation to do something totally contrary to what everyone's doing, which is go out of your way to on purpose form these relationships that mean a lot to you. And that's another thing is men will often come to therapy saying like, well, my wife says I don't have any friends, or I'm a loner, and it's not helpful to be like, well, we just need to get you a bunch of friends. Oftentimes, I don't think men want a bunch of friends. Some of them do, that's perfectly fine, but they want quality friendships. And so it's not enough to just like have a bunch of social connections just to have them. I want to have something that I really enjoy with someone. And so it's like one actually just last week, an exercise I was doing with a client was, are there mentor figures in your life? Are there people that you notice and you go, okay, I really like what I see. I like the kind of person that they are. I like how they interact with their career. I like how they live out their life within their marriage, and how they are as a father. Um, can you take the small step of saying, "Hey, could we grab coffee sometimes? I really admire what I see in your life, and I would want to learn from you." Again, we're coming back to vulnerability now. It's these little acts. It's getting really good at going, "Hey, I don't know where this is going to land, but reaching out, making connections with people is so much better than trying to do this whole thing on my own.
Yeah. So how do working with men to figure out what connections do they already have, and then how to kind of foster those connections into a more meaningful place
Yeah.
to be able to talk about things.
Yeah. I think pursuing the other men in their life that they find admirable.
Yeah.
Yeah.
Something I know I talk about pretty frequently with my male clients is the perinatal side. We've talked about the anxiety, depression, substance use, and how those kind of
Yeah.
trickle in and are, either talked about or buried. But that perinatal, I am seeing more and more men coming in and talking about, the stress they're feeling with a new baby, how they're learning how to parent their first kid, second kid, so forth. And then the big thing I hear is like, how do I support my partner?
Right.
She has her own,
Yeah.
feelings about, being postpartum or, learning how to parent too. So I hear parents, men coming in and talking about not only are they, the partner, but now they're a new parent who is
Yeah.
learning how to, while also, supporting the family, being that male
Hmm.
figure. And now they don't know how to support, their partners.
Yes. It's a whole lot.
It is. It really, really is because like you can see that they're trying so hard. They just want to fix
Yes.
what's going on. And the reality is that the situation isn't
Yes.
fixable
Right.
on them to do that work.
Yeah. Like that is, I want to ask you how you interact with that in a minute. One thing that's coming to mind for me is, a lot of the work that we do as therapists is helping people to give attention to the things in their lives, the variables in their lives that they can't control, and not give too much attention to the variables in their lives they can't control.
Yep.
And so when you have a child, and when that child needs his or her mother like perpetually, and you want to find a way to help, but honestly, there's very particular ways that she needs your help, and not all the time, and it feels like, man, my attention is just constantly on something, a variable I can't control or do anything about, which often does lead to feelings like depression and anxiety or self-medicating behaviors or that kind of thing. So it's an incredibly hard time, you know. And I have other thoughts, but I'm really curious, like how do you engage that?
Yeah. I mean, I think I come at it from a couple different angles. I am, whether it's postpartum, whether it's no kid, self-care.
Yeah.
How are we taking care of ourselves? How are we fitting sleep in when we can, which we know with littles is not always the easiest.
Yeah. Yeah.
Are we doing things that we enjoy doing, during naps or after the baby goes to bed? Like, how are you still kind of feeling who you are as a person? Like, you're a parent, and that
Yes.
takes priority most of the day. And like, how are you still being your own kind of individual as
Yeah.
time allows? Something I talk to folks about, and this kind of goes back to what you said about like, if the mom is doing a lot of like the heavy work with the
Yeah.
baby,
Yeah.
you know, doing check-ins, the dad saying like, what am I doing well? Like,
Hmm.
what do you want me to keep doing? Like, how am I supporting you, and how can I continue to support you? That's helpful.
Hmm.
That communication piece, because I talk a lot with folks about how the mom sometimes feels like the burden is all on her.
Yeah.
She does everything, which in some cases is correct.
Right.
Like,
Right. At least for now.
mom
Yeah.
just does the things, packs the
Yeah.
lunches, does the breakfast, like just kind of takes that on.
Hmm.
And honestly, what I hear often is the dad doesn't really know how to do those things because the mom just like does them.
That's a
So,
really good point.
yeah, so some
Yeah.
like the mom's taking a step back and giving the dad the opportunity to do some of the nighttime feedings or to do some of the diaper
Yes.
changes, like
Yeah.
having that partnership in the raising of the kiddo, so
Yes.
that way the dad does feel involved and then the mom doesn't feel so overburdened with
Yes.
having to do all the things.
It's really two sides of the same coin. Like in the same way that maybe the mom is going, I need help. I need someone to help me with something. there's like this over functioning, under functioning dynamic where, in order for the husband to feel like, oh, I can function more for her, I can do more things to help. There's like this symbiotic thing where she has to go, okay, I'm not going to do as much. I'm gonna free up my own space to take care of myself more, so he can take over. They almost have to happen at the same time,
Yep.
in a way.
Yeah. And I think that again goes just back to communication. What is it that
Yeah,
I can do to be more supportive to help you feel like it's lessening the burden on you?
yeah, absolutely. I also think I think because there's a lot that can be done there, but there's also this piece of the puzzle where no matter how much, actually, I've had this come up a few times recently, no matter how much a man is doing, especially when, baby's really little and really needs mom for a lot of things. Um, it's like there's really only so much I can do. Even if I do a lot,
Mhm.
baby needs mom right now.
Yep.
And so I've found it's really important for men to be able to contextualize that season of their life, in a way that helps them see like the bigger picture, that, hey, this is just a season of life. And it's really hard. Like it's a kind of suffering for both of you in unique ways. Um, but it has a context, like, which is that right now your child needs her more. And as you get older, that child's going to need you a whole lot more. It's going to need your guidance. It's going to need your help. It's going to need your involvement, your presence,
Yep.
and that things will shift as the child grows older. I heard, there was someone, I can't remember who it was, said that as when a child is younger, they need their mother much more, and as they get older, they need their father much more in terms of guidance and preparation for the world. And I think there's something very true about that. And so I think helping men kind of put things in context and go, yeah, this kind of sucks right now, but it's just part of this process. It's not how it will be forever.
Yeah. Yeah. Absolutely. Okay. Anything else you want to add about? I mean, I could talk forever about you
Yeah.
know, mental
I feel
health
like we
for
could go
men.
round and round on this.
Yep. Yep. Absolutely. We've kind of touched on the social kind of expectations, but you know, that traditional male standpoint, men should be strong. Men shouldn't talk about their feelings. Men should just gloss over things.
Yeah.
Um, and what is that doing for men in their own personal kind of experience, but then also in relationships,
Mhm.
talking about feelings,
Yeah, yeah.
with their partner.
That's so tricky. Uh, because I think this is something I could rant on for a while, but I think that right now, for men find themselves in a real double bind, just kind of damned if I do, damned if I don't when it comes to the emotional expression thing. It's like, okay, my wife or my friends or a family member, they want more from me. They want me to be vulnerable. They want me to be in tune with what I'm feeling. But then if I really were to put that out there, if I really were to show them that, to give them that, I'm met with a kind of sometimes disgust or sometimes disinterest, or like, oh, actually, I kind of want you to pack that all back up. I liked it better when you didn't.
Yep.
I don't think people mean to send those messages to men, but often that is what happens. Um, and it's probably a growing pain, I think, culturally for all of us. Like when a man shows up and says, "This is what's going on for me," because we're also used to men just going like, "It's fine, I'll do it, I'll take care of it." It kind of is, it throws off your equilibrium. You're just kind of like, oh, you have feelings actually. I should care about them. But in some ways, it's like learning how to attend to the feelings of men. So I think it's a real tricky thing right now, and I think it starts with finding people who are safe to do that with. You know, um,
Well, it sounds like a fine line, right? Like
yeah.
not saying feeling they can't say too much, but
Hmm.
then like not saying anything either. Like
Right.
finding that balance. And that's gotta be a tough place.
Yeah, finding the appropriate way to express what's going on. But I don't. There's that. Oh, I can't even remember. It's a Brene Brown video from like when she first kind of came out, and everyone was very excited about her. And she talks a lot about vulnerability. I really love her stuff. But she makes a great point where she talks about, she gave this amazing talk about vulnerability, and then a man came up to her after after the conference and said, well, how does this apply to men? And she was like, oh, I guess I don't really know, like you got me there. And he was like, if I for a second, show my vulnerability to my wife and my daughters, it's like no one wants to hear that. I mean, it makes them feel very insecure and very, so it's a really tricky thing. And I think it is like, I think men have to start testing it out with other people that they can really trust to hold what's going on in their life and can help them navigate how to express it with other people. But I think societally we have a long way to go.
Which makes therapy a great place to kind of practice that,
Absolutely. I think
you
so.
know,
Yeah.
confidentiality, what happens in the room stays in the room, being able to,
Yeah.
be authentic, and kind of practice those skills of being vulnerable.
Absolutely. I think therapy is a great way to kind of uncover a lot of what we're talking about.
Um, so the number three,
Mm-hmm.
the roles that men have
Mm-hmm.
can impact mental health and lack of fulfillment. How do you see that working with men? How do you see that kind of playing out when you talk to men?
Yeah. Maybe I might have a little different perception on this. Um, I think there's no role that a man can take right now where he feels like I'm doing a good job. um, if he stays at home with the kids, there's still that societal expectation that like, well, you shouldn't be doing that. You should be working. There's still, I think, a masculine desire to be doing something. So there's that struggle. But even if he like joins the workforce and works really hard, well, now you're kind of forsaking the emotional needs at home. It's like it feels like a kind of like no matter what role he fills. So I think the stereotype isn't so much about which role it is, but how the man's supposed to fill the role. That he's kind of supposed to do it all, all the time. That he's
Uh,
supposed to fulfill everybody's expectations regarding take not necessarily not in the same way that I think women have these like heavy expectations, but in the sense it's like you just need to do whatever needs to be done and not care. Just do it. Um, and so I think sometimes, especially when I do couples therapy, I see this play out where there'll be a couple that comes in and there's usually like some kind of dispute about like, hey, domestic work isn't very equal here. I'm as the wife will be going, I'm doing a lot more of this than he's doing. And then when he tries to get more involved, it's like he's shamed for doing it wrong, or there's it doesn't really matter what the role is. It's you have to do it really well and perfect. You don't have, there's not room to grow. you know, I
which
think
isn't
that's the bigger issue,
realistic. Like,
right? For anyone.
mhm.
Yeah. Well, I don't know. How do you see this play out? The role stereotype situation.
I mean, I see the same things. If a man or woman, works all day, comes home, and then there's still the expectations of
Yeah.
dinner, bed, bath, like
Yeah.
all the things that still need to be done. Like there is only so much time in the day and so much energy really
Yeah.
to keep giving. Something I talk to folks about is kind of switching off every other day, but like, one day, one partner, an hour, maybe in
Yeah.
between like dinner and like bath start, having an hour where they get to do like their activity.
Yeah.
And then the next day it switches. And not everybody needs it, and not everybody needs an hour. And it can be
Absolutely.
molded to however
Yeah.
it
Yeah.
fits the person. But I have heard amazing feedback of taking that hour makes the rest of the evening go so much better. Like just being able to like fill that with
Yeah.
whatever it is. Like, sometimes it's like house projects, or sometimes it's working out, or,
Right.
whatever, reading a book, but like really trying to give back to themselves can be significantly impactful on how the rest of the evening goes.
Yes, totally. I have one more thought on this. Can I share it?
Absolutely, please.
I think part of the role struggle too is that um like the risk of saying something that could offend someone here. I think men and women are different in that they're not going to parent the same way all the time, right?
Yep.
um, and so if a dad's at home alone with the kids, how he chooses to spend that evening, what he chooses to give them for dinner, fill in the blank, it's going to look different than if mom's at home with the kids. And I think part of the role struggle is allowing him to do his role the way he would do it, and him allowing her to do her role the way she would do
Yep.
it, and it not being this competition or, well, you need to do it more the way I would do it as a woman, or you need to do it more the way I would do it as a man. Just giving space to like, neither are wrong, they're different. That's fine, you know?
Yeah. Yeah. And I think that ties back to letting each other learn how to
Yeah,
do things.
right.
My way isn't, as much as I may think it is, my way isn't
Right.
the correct way. Like,
Totally.
other people are allowed to have a difference in how they choose to do the thing.
Yes.
But I think you're absolutely right. Like, allowing two parents to be able to parent individually and
Yeah,
not exactly the same way.
totally.
Yeah. Um, Promoting mental well-being. I think we've talked about a lot of these,
Yeah.
encouraging communication, talking, doing check-ins. I talk a lot about a once a week meeting
Yeah.
between couples, like not long, 45 minutes, an hour, maybe just to go over schedules, to go over, I always say this is like our meal planning time, like a
Yeah.
grocery shopping making list, but like also practicing maybe some of that like vulnerability. Maybe that
Yeah.
is the time to ask the questions of what am I doing well? What do you want me to keep doing? What am I doing that maybe you don't love so much? Like, but opening up that line of communication to be able to start having, deeper, more meaningful, vulnerable conversations.
Yeah. I like the healthy lifestyle one because I think that's a big one. I mean, men, because men, there's so much often put on a man's plate to do in a day.
Yeah.
It's pretty easy to neglect like real basic things that just make a person generally like their mood more stable, their health better. This is where substance abuse definitely comes in because if you're exhausted and you don't have the energy to like, I'll pack my bag and go to the gym or whatever it might be. I mean, a way to just feel instantly better and get a dopamine hit is to drink or to use drugs of some kind. I mean, that's like the most easy answer when life is super stressful. So it's like being proactive. I was working with a guy a few months ago, and there was this moment where he talked at length about how much he loves being outside, loves camping, loves hiking. And at the end of our conversation, I was like, "Well, when is your next like hiking trip then?" And he was like, "Oh, I haven't even done that in like I've done that in a couple of years." And it was like, "Oh, this is what you need. Like this is exactly it right here. Is like don't neglect the things that are most important to you, even though you feel like I have to do all these things for my work and my family. Of course you do, but you can't neglect yourself in the process. You have to protect your gift, otherwise you can't give it to the world. So
Yeah.
it's like, man, you got to go hiking or you got to do the thing that really makes you feel most alive. So I think the healthy lifestyle thing, self-care, all of that, I mean, to me it's like the center of a lot of this.
Yeah. Yeah. I think I hear, you know, who has the time, Heidi? Like,
Yep.
who
Yep.
has the time to do all of these things? Like, I've got all these other things on my plate, and I think that
Yeah.
that's definitely a barrier sometimes. Like, how the things will always be there, is what I
That's
say.
right. That's
Like,
exactly
there's
right. Yeah.
always going to be laundry. The lawn's always going to need to be cut. Like, those things, they're just always going to be there.
Exactly. I tell people like decide right now that your to-do list is going to be infinite. It'll never go away. So just Don't reach the end of it, because you won't ever reach the end of it. If you wait till you
Yep.
reach the end of your to-do list, you'll never go do the stuff you want to do, so
Yep.
let it be infinite. Go do stuff anyway.
Yeah, yeah. And allowing yourself and giving yourself permission
Yeah.
to do that. Like I think that's always tough for folks because they'll go do it, but are they like fully invested? Are they
Yeah.
fully in it? Or are they like, well, we gotta go. Like I got
Yeah.
stuff I need to do. Like really allowing yourself to enjoy that time.
Yeah. Yeah, I think that's huge.
Yeah. Um, you know, opportunities to connect with other men, however that looks. There's um if folks are, into going to church, there can be
Hmm.
church groups.
Yeah.
There can be, you know, I I say this with a grain of salt.
Hmm.
But like the meetup website
Oh yeah.
has like hundreds of opportunities for people that meet up and do things. So like for your fella that wanted to go hiking, there's like hiking groups. There's
Right.
there's groups where folks go to the library and read together.
Yes.
Like, but that's
Yes.
holding people accountable because they have this plan that this is what I'm going to do.
And we
But
expect you're going to show up.
yes. And
Yeah.
then they like, yes. So I think it's, looking in and seeing what the community has to offer and then getting involved as much or
Yes.
as little, with what time that they have, but forming some connections, whether they're, you know,
Yeah.
very surface level or deeper, but still having that time around other people with similar interests.
Absolutely. And I think that most of that battle is just putting yourself out there, going to do it,
Yeah.
going to the group, making the phone call to get something started. It's like once you do that, you can get some momentum. You just make friends and be around people. It gets easier,
Yeah.
you know?
Yeah. The more they go, the more
Yeah.
they see the same people.
Yeah.
Yeah. Importance of seeking help. I mean, I always talk about like people aren't mind readers.
Yeah.
We can't see what other people are going through or thinking. So reaching out and whatever kind of like help they're looking for,
Yes. Yes.
because people can't help if they don't know what's going on.
Yeah. Yeah. There's a real, to me, the reaching out for help, and talking about what's going on, a really complicated matter for most men because, um, oftentimes if a man has a hard time expressing what's going on emotionally or be even knowing what he's feeling, that's really common. I don't even know what I feel. I'm just kind of
Yeah.
here, that's real common. It usually has something to do with upbringing, and has something to do with like society, the community they were raised in. It could be a really strict religious community. It could just be a really chaotic family life growing up. But somewhere in there, this message came across that's like, what you feel and think about life is not the point. So just keep it in. And what's difficult about that is oftentimes because that's what feels normal and that's what you grew up with, you kind of recreate those relationships, whether it's with friends or a spouse or whatever. And so you kind of instinctively kind of surround yourself with people who reinforce the same message. You know, we love you for what you do, not who you are. They may not say it overtly like that, but that's kind of what it comes across. So I think the complication is seeing it enough to go, okay, I may have to pull out of the current community situation long enough to find a new one, or pull out of this all of the feedback I'm getting from this one person, find a good therapist or whatever it is, to get a different perspective on how I should feel and think in life and approach my world, rather than
Yep.
the one I've kind of had my whole life and continue to surround myself with. I don't know. Does that make sense?
Absolutely. Yes. Well, when we hear the same message
Yeah.
over and over, like men, like that becomes their reality, right?
Yeah.
Like their reality becomes the message that they are given, whether it's overtly or not, like it
Absolutely.
doesn't matter.
Yes. Yeah. So I just like the courage to go, I've got to find a new perspective to see what else might be going on, you know.
Yeah,
Therapy is great for that. Support groups are great for that.
yeah, yeah. I think that not all of the men that I see, but some
Mhm.
of the men that I see, they weren't the one to make the call either. Like
Yeah. Yeah.
someone else in their life did that for them,
Yes.
which I think is showing that support and like that just makes it a really cool kind of experience to work with them because like I mean again it same difference sort of but like
Yes.
when they feel supported by whoever it is that made that call, them coming in makes it
Yeah.
uh, like a very like supportive kind of environment.
Yeah.
Like
It sends
someone
an
cares
entirely
enough
different
about me.
message.
Yes. Yeah.
Absolutely. I think that's amazing when men do have people in their lives who are willing to walk the path with them,
Yep.
help connect them. Um, that's beautiful. Yeah.
Yeah. Absolutely. Resources.
Mhm.
So Skyler and I see men at Marvel Wellness. My name is Heidi. I know it says Stephanie on the I don't know how to change that, but I am Heidi. So Skylar and I meet with men. Um, you know, we I try to be pretty like open in my sessions as far as where we meet. So the park, I do a lot of park sessions, even if we're not walking, just sitting like under a
Mhm.
pavilion and talking. Um, you know, trying to like move. So
Yeah.
um, we offer in office and virtual sessions as well.
Absolutely. Yeah, I think getting plugged into therapy for men can be quite a game changer because it is. I'll say this, just speaking for myself, just disclosing that, like when I was in my early 20s, finding a good therapist really freed me up. It helped me talk about things that I had not had the freedom to talk about with anybody in my whole life, you know. And so I did. And once you can kind of put things out there and sort through your thoughts and actually notice what you're feeling with someone you can trust, um, all of life just feels lighter and easier. You can kind of rediscover your own values, actualize your own goals. Um, it's a huge game changer. So, of course, I'm a therapist. I'm an advocate for therapy. I think it's a huge resource for men, for everybody. But I think it's really important to reach out.
Yeah. Yeah. And I think with men, sometimes what I've noticed is it's sessions, like the initial sessions are very solution focused. So, like, here's the problem, here's the coping skill, the action plan, the this, the that. So it can
Yeah,
start out being very solution focused in nature, and then it can end, and that's cool.
yeah,
Or it can kind of transition to these other things that maybe they're ready to talk about too.
yeah, yeah.
You know, it doesn't, therapy just in general isn't a one size fits all model. So if
That's
there's
right.
something very specific that wants to be addressed, then that's where we go. That's where we
Yes,
start.
yes. Yeah, I've worked with men who like they want to see me for just a little while to address. I have to do public speaking at work, and I'm anxious
Yeah.
about it. Okay, we can work on that. Sometimes that rolls into something more. And then I have other men who it's like I need to unpack a world of trauma and pain. And you know, they're very different things, but therapy really becomes whatever you need it to be for the most part.
Yeah, absolutely. I think that's the end. Oh, conclusion. Increased awareness. So, you know, talking about therapy, talking in safe places where it feels safe to be vulnerable, which we talked about earlier, how it's difficult for men to find those kind of
Yeah.
places. So as they become available, being able to kind of do those things, have those conversations. Um, Advocacy and action. Uh, so again, like that solution focused, here here's where it feels comfortable to start, as opposed to trying to dive in and talk about all the feelings. That is something that they've been conditioned to not talk about.
Yeah. Yeah. As we kind of wrap, can I give like one, I don't even know, just like an action step to people?
Please, please do.
So I think it probably would be most rational to like give an action step to men. I actually want to do something a little different. This is just to men or women or anybody.
Okay.
It's just if there's a man in your life that you feel like he's disconnected, depressed, struggling, I think the best thing you can do more than tell him what he should do or try to get him to go to therapy right away is ask him how he's doing and really mean it. Really, really sit down and just and what you may find is he has a lot to say, or a little to say, or maybe what he says feels a little intense or not politically correct or offensive or riddled with pain. And the best thing you can do is just send the message. It's okay for you to feel that way. It's okay for you to unpack that. Doesn't mean you have to agree with everything he says or like any
Yeah.
of it. Doesn't mean any of that. But I think that's like a huge step that people can take is like, because most of the time when men are asked, how's it going? The question's not really meant, and that's why, and men pick up on it. So if there's one thing I think we could do, even just today, to like make things better and reduce the stigma and improve
Mhm.
men's mental health, is ask questions and really hear their answers.
Mhm. How would you go about if the partner asks the man that question and the man's response is, "Nope, I'm good.
I think that's okay.
Everything's fine."
Yeah, I think that's okay. I think it's like keep coming back, keep doing it,
Yeah.
keep extending the opportunity. Doesn't mean you have to pester. I would recommend not pestering, but you know, but even if it's just very surface level, oh, everything's fine, don't worry about me.
Yeah.
There's going to be some time at some point where something cracks a little bit, and I kind of have to talk about this to somebody.
Yeah.
So if you become the kind of person that's extended the opportunity, you're a
Yeah.
trustable presence. It's a really big deal for a man to be able to share with somebody.
Yeah. Because maybe at one point asking that question,
Yeah,
it could be like, "Oh, yep, today, like I got to talk to this person about what's going on."
absolutely.
Yeah.
Yeah, absolutely.
I think something I do with folks too along those same lines is having a notebook that goes back and forth. I think sometimes verbalizing
Yeah,
feelings and words can be like, I can't even get this word out of my mouth. Like, I can't say it. And having like something that kind of goes back and forth
I
without the
like that.
pressure. I always talk about how it's not the pressure of like as soon as I get this, I have to respond, but like leaving it, taking some
Yes.
time to process, like, and being able to kind of thoughtfully respond without having to like make eye contact with somebody and like talk about it.
Yeah. I think that's a great idea. Yeah, it gives more space to really develop what is going on and write it out. I think it's great.
Yeah. Yeah. Or, you know, check-ins. Oh, one thing I really like, I don't know where I got it from, but it's we kind of talked about it earlier, like the what men have to do throughout the day and then
Mhm.
coming home and then having to like adult there too. Something that I talk to folks about is um giving a percentage, like the couple giving a percentage of what battery they have left for the day.
Yeah.
And it doesn't have to equal 100.
Yeah, yeah.
Like, that's not the goal. But like, and then being able to check in, and honestly being like, it is a pizza night
Yeah.
tonight. Like, I have nothing left to offer. Like, and percentaging it like that is a vulnerable place to be. And it's not putting words to it either.
Yes.
So like it's not listing out, the man's feelings throughout the day, but it's saying at this point my battery life is this.
Yes. It's still the vulnerability of saying this is where I'm at, this is what I need right now, without having to dive all the way in. Yeah.
Yep. Like a quick little like
Yeah.
check in.
Yeah, that's a great idea. I like that.
So, okay. Well, that's anything else you want to add before we sign off?
I don't think so. I think this has been really, I've really enjoyed talking to you about this. And I think I think the more we can keep this kind of conversation going, the better, you know?
Yeah, absolutely. Okay. Reach out to Marble Wellness for men's mental health.